All right, so welcome everybody. My name is Rhoten. I am president of the foundation of the hospital. And we're gonna talk a little bit about opioid addiction and what the hospital, the foundation, and some of our local partners are doing to combat the addiction, the epidemic that we're seeing locally. So at any point, if you have any questions, please, like I mentioned, cut me off, whatever you want, disagree, think that we need to do more, please let us know. Everything that we're gonna show you has come about through dialogue like this, so we take no credit for it. These are not our ideas, these are ideas that we've kind of compiled and put together in resources that we have put together with partners, and thanks to John. The website you'll see later. Please, if you want to talk to me offline afterwards, anybody watching at home, please call. My number at my office is 814-333-5936. Then they'll get me directly, so thanks very much. What we're gonna do is first cover some statistics, and I gotta apologize first, these are a little outdated. These are back from the fall. We could almost compile all of 2017's data at this point, but I haven't updated this until we get everything, which we'll have pretty soon. And you'll see that information. We'll share that publicly once we get it. After this, we'll talk about Let's Talk. That campaign is. I'll share some of the resources we have, and then Tracy, who's director of our Community Care Network, and that we've created through Let's Talk, cover some of that information. So, thank you. Nope. So in 2016, and this is through the first 3 quarters of 2016, there were 99 new admissions to our intensive care unit, and 42 were alcohol related. This is above and beyond what we saw prior year. So we saw many new admissions. The intensive care unit is where anybody goes when they come through our emergency room for an overdose. All of these 42 drug and alcohol related incidents were not necessarily overdoses, but this is where they all initially end up. It's kind of hard to read, but essentially the red line is 2017. It falls off here simply because the data wasn't available at that time. And the blue line is 2016. And this is the number of alcohol, drug-related ICU admissions year to year. So you can see from essentially August of 17 on, we saw, actually this would be August of 16, and this would be August of 15. And you can see steady increases month to month. We actually had 1 month, I believe it was March, it's been quite a while now, it was a year ago, but I think it was February, or 1 month in the first quarter where we saw an overdose in emergency room on average of one a day. So that's very high compared to what we typically see, but for an entire month we saw 1 overdose a day. Stepping Stones is our inpatient drug and alcohol treatment facility. That has seen an 11% increase year to year from 16 to 17. And our emergency department, as I mentioned, these are overdoses. From August 15 to August 16, there was 42 overdoses through the emergency room. August 16 to August 17, it over doubled to 110. So quite an increase. And if you look at substances, and there's a lot of theories around why we see growth in certain areas, but all of them have gone up, and some of these can be dual substances, so a person could have multiple substances during an overdose, but you can see the blue line, the blue columns are 16 and August to August, of February 15 to 16, and the green is August 16 to August 17. Significant growth in heroin, and the other two I've seen it as well. But heroin has become much more prevalent locally. Demographics. So there are some trends that we see with this epidemic in particular. It is predominantly a white epidemic. So 80% of overdoses in Crawford County were white individuals. 64% were male. And there's only 2 columns for age groups, but essentially there is no discrimination among age. It is affecting everybody. If you would look younger, so this is 70% of the total. If you look younger in the age, I think it's 18 to 30. And then if you would look at 61, I think to 75, they're about even. So there is no favoritism towards a certain age group. And the reality is because of the nature of this, and a lot of the people who become addicted through prescription painkillers, prescription opioids. There was a study that showed that 92%, doesn't mean that all these individuals started with prescription opioids, but everybody who's overdosed, 92% of those individuals have had at one point a prescription that was given to them. So again, it doesn't mean that all of them started started their addiction with a prescription opioid, but at some point they've had one. So surgeries, traumatic accidents, whatever it may be, they're prescribed an opioid, and then for whatever reason have become addicted. The national trends actually are similar, except for in the white column, it's actually higher. So we're a little lower here, but we've seen some data that would suggest that it's closer to 90% instead of 80% where it is here. But generally speaking, what we see locally is similar to what is occurring nationally. And this is actual deaths that have come from opioid addiction or opioids since 2014. So the number was kind of doubling. 2014, there was 15 overdose deaths related to opioids. 2015, there was 28. 2016, 39. 2017, this was a prediction based off of the trends that we saw. We thought we would see 1 overdose death per week, approximately, in Crawford County. Fortunately, we didn't see that, so that's why there's an asterisk here. This is not 2017's actual number. We actually saw a decrease. And do you know what the final number ended up being?
I thought it was 37 or 38, but I'm not 100% sure on the final.
From what I understand, I haven't seen the final number because I was waiting for some toxicology reports to come in. We think in 2017 there was a decrease from the number of overdose deaths in 2016. Now that sounds good, and that it is good, but that doesn't mean necessarily that we've affected addiction at a macro level. Certain drugs that have been made available, like Narcan, naloxone, Narcan, they are administered when somebody overdoses, and it can save their lives. Doesn't necessarily mean, though, that addiction itself has been impacted. So seeing less deaths is obviously a great trend, something good to happen, but there's a lot more work. We can't simply rely on that figure. Any questions about the statistics? So we will publish a more comprehensive report once we finalize 2017's numbers to kind of show what happened last year, and we're going to use those figures as baseline information for what Let's Talk is going to try and do, and some of the resources that we're rolling out. We're going to use those numbers to hopefully show over the next 2-3 years that we've made a significant impact. I will say that somebody asked me, when you look at the last slide of overdose deaths, I don't know if I can pull it up. how bad can this get and where can this go? We, compared to other counties in Pennsylvania, are behind the trends. So our hospitalization rate in Crawford County in 2016 related to 2015, I'm sorry, related to addiction was almost half of that what we see in some other counties. So this isn't overdoses, this isn't certain treatments, this is people who actually have to go into the hospital because of their addiction. We are at half the rate of what other counties are seeing. So the numbers, if we do nothing, could get much worse. Some counties are seeing 1 in 2,000 people are being hospitalized because of addiction. So that's why we're going to do some of these things that we're doing. Any questions about the statistics? On the back of, on the counter, there's some flyers. I'll just kind of talk through them real quickly. So Let's Talk came about every 3 years. The hospital conducts, along with Allegheny College and the community, a community health needs assessment where we look at what our biggest needs are locally, specifically related to healthcare. And when the report came back, there was the general concerns that we see related to obesity, but one of the more glaring issues that came about was this issue of addiction, and specifically opioid addiction. Now, this wasn't new information to us necessarily. We had seen what's happening nationally. We know what's occurring, but when the community health needs assessment came back, it was extremely apparent to us that we have to do something, pretty quickly. The trends were not favorable and things are rapidly getting worse. So the foundation had a special board meeting and decided that we're going to commit resources to combating the issue. And we're going to do that in 3 primary ways. We're going to bring awareness to the issue. So drug addiction, as most of us know, and if you're here, I'm sure you're familiar with it for some reason or other, has a negative connotation to it. For whatever it may be, there's this stigma that because you're an addict, you have done something to a point that it makes you lesser of a person. And that's not the case. We want people to be aware of what's going on so that they talk about it. Let's talk. It's pretty obvious what the goal is here. We want dialogue to occur. We want people to be aware that it's all of us who are facing this issue. It can become all of us at any point, and it's not some lower life individual living in a back alley. I mean, it's all of us who have to deal with this. The second thing we're going to do is bring education around addiction. So instead of the generic thought process that some of us have around what is addiction, that people are weak who are addicts, we're going to put out education around the disease that is addiction, what tools like Narcan, naloxone actually can offer. We're going to bring a lot more education around it so that people don't have to kind of ask their friends about information, that they'll have it all available to them. And then lastly, and probably most importantly, access to services. Too many of the stories that I've heard personally in the last 6 months that we started this process have been around, I've been an addict for 10 years. I know somebody who's been an addict for 10 years. And when I delve into their stories, it's almost without hesitation, without any sort of inconsistencies in their stories that I know they're going to tell me the first 2 years, 3 years, they didn't know where to go, they didn't know exactly where to access services, and when they needed it the most, it wasn't there. Or at least they didn't know that it was there. So we're going to bolster access to services and make sure that people know exactly where to go and can get it when they need it. And if we find that there are gaps in services locally, we're going to act upon them as well to make sure that we do everything possibly to make every service available to everybody. So those are our 3 primary goals. Any questions about them? Have we missed a key target? Online resources. So if you go to, I'll show you the website in a second. If you go to, it's on the bottom of the flyer, letstalkhelps.com. You'll find there a variety of online resources that is offered from many of our community partners, not necessarily us. So locally we have the Crawford County Overdose Prevention Coalition, and then we have, that organization, that coalition is comprised of many, many groups who are providing what you'll see online. So treatment centers, support groups, hotlines, an interactive calendar. So if you're looking for AA meetings, it's not just opioid specific. If you're looking for AA meetings, NA meetings, Narcotic Anonymous meetings, you can find the location, the dates, contact information, it'll be there for you. Counselors, and then lastly, our resource navigator, which is a new position that we're creating. And we've been interviewing, and Tracy will give you an update on the resource navigator in a little bit. And there is no obligation, and it is a free service. So our website is completely free. We set it up, but we don't consider it ours. We consider all of this community to be a community resource. So if you need anything from us, if you want flyers, whatever it may be, go to the website, submit a contact us request, and we'll get you the information that you want the best we can. And then some of the facts here that you can read in your flyer. And then lastly, as I mentioned, it's a kind of the foundation is funding it, and by the foundation funding it, that actually means that donors, individuals in our community are paying for everything that we're talking about, which is pretty impressive. We hosted our like a fundraising event in the fall, I believe, raised $25,000 in one night for it. We saw a memorial set up for a young gentleman who passed away from overdose. We had over 200 individuals give in his memory to this campaign, and just through that campaign they also raised $25,000. So the community support is incredible. We're going to promote that because we don't typically quantify numbers of individuals, but in this case we want people to know that if there's 200 plus individuals willing to open up their wallet and give of their personal cash towards this effort, there's a lot of good intentions in our community, and it's not this negative connotation everywhere. So I think that's a positive for everybody. We've created commercials. If you go to the website, you can see a video. We just rolled out this campaign publicly in February. And within the first, I want to say, we rolled it out February 1st. There's been over 1,500 visits to the website since then. On Facebook alone, through our advertising efforts, we've reached 25,000 people just through impressions. 5,000 of them have taken action upon that. So either requested information, contacted gone to the website, and looked up more information, messaged us. So it's pretty impressive, the reach that we've hit in only 2 weeks. And once we roll out these commercials and do a little more advertising, I think we'll get our word around pretty nicely. So I'm going to play this video real quick. I hope we have sound. Yeah.
I walked in the door and my oldest spoke and was just bawling her eyes out. my first words are, is he dead? I mean, I don't know. But it's just by the tone of her voice.
We're in the middle of the largest opioid-related epidemic in the history of our nation. The epidemic has reached proportions that we've never seen before in our country, and it's something that we have to act upon immediately.
Let's Talk helps us get that community conversation going so that more people are less likely to become addicted to begin with, and we'll have the resources to help friends and family members know where to seek help and get into recovery, because recovery is absolutely possible, and that's where we want to see people end up.
Let's Talk is important for three main reasons. We're bringing awareness to the issue, education around addiction, and access to services.
We have a lot of resources available in this community, and unfortunately, folks, until they really need the service, don't know how to connect with them. So I'm really glad to be able to help with that. And from the hospital perspective, my hope is that the Let's Talk campaign is really going to raise awareness.
There are a lot of people, even when we speak in the community, who are not aware of what has been in existence for quite a while. So part of this and the job of not only Stepping Stones in our outreach and the Overdose Prevention Coalition is to get the information out there. What is available right now? How do you access it? And again, this will just be, Let's Talk will just be another layer of, providing that access to people immediately if necessary.
This is not a problem or issue that's isolated. It is widespread across our county. People from all different walks of life are impacted by addiction, and it's about time that we raise awareness.
I think that that's important, that we all become unified in our efforts to improve our community and the wellness of our citizens.
And then as we've kind of slowly started to roll this information out, people have been flocking to us, not only for help, but to tell their story. And it's just blown me away how willing people are to tell their story, even as uncomfortable as they are or can be telling it. Just because of the impact they know that it'll make, and that hopefully one person out there hears their story and is willing or decides that they need to step forward, ask for help, or try and find help for somebody else who needs it. So on our website, up at the top, there's the resources tab, local services, the interactive calendar, support groups, contact us, donate for anybody who wants to support it. A little more information about it, but really under the resources tab is where most of the information is. And if anybody's got questions, whatever it may be, they can contact us. Like I mentioned, they can call me, they can submit through the contact us tab, but we're really excited about it. It's got a lot of traffic already, and we hope that that continues. I'll show you a couple of videos. Just two more testimonials. So we get the volume. So the trailer has already been shared. These are on the website, so they're obviously shared, but we haven't started really promoting them yet. These are just the first two commercials. The trailer is not necessarily a commercial, but these are the first two commercials that you'll start seeing on TV pretty soon. And we're in the process of starting production for a third, and then we'll probably end up doing a fourth later in the year at some point. If it's really loud, I'll turn it down, I'm sorry.
Let's talk about Daniel. My heart, my love, my only son. There's something Daniel didn't want to talk about. Suffering from depression, he turned to drugs and alcohol. They gave my son life, couldn't give him a way out, no matter how hard I tried. If you're struggling with addiction, there is hope. There's somewhere you can turn. But first, you need to talk. I'm proof that you can successfully go through recovery. Since I've been in recovery, I graduated from college, I've gotten married, I have a family who actually can trust me now and who loves me and is very supportive. I have this position here at Mercy House and I absolutely love it. I couldn't be more blessed. I just really want to share with people that if you're struggling with addiction, there is hope. There is always somewhere you can turn. But first, you need to talk.
So Pam's story was about her son who lost his battle, obviously, and then Lisa's story, if you see either of them around, well, Pam, I think, has moved down to Florida, but if you see Lisa around, give her a high five, give her a hug. Her story, we only covered a short one here, we'll have a longer version of it that we'll share as well, is incredibly compelling and proof that you can hit a low and come through recovery. It's an absolutely awesome story. Lisa's impressive. Daniel and Pam's story will be the only one that we cover, probably the only one that we cover for quite a while around the loss, because we have seen a lot of these campaigns, and I won't name any of them, but they're depressing. And we're not going to simply focus on the depressing side of it, because we are focusing on the positivity around what happens after addiction and through the process of recovery. So you'll see a lot more of Lisa type stories, and you'll see a lot more education around what options are out there and who you can contact. Any questions for me before I hand it over to Tracy? If you want myself, if you want anybody you saw in the trailer, from Ken Lowe from Stepping Stones, if you want Jamie Ferry from Crawford County Drug and Alcohol, for anybody watching at home too, anybody wants somebody to come present to their organization, their club, their business, we're happy to do so. I will say that I don't know when this is going to air, but it'll be online, I guess, soon. March 14th, if you are a business owner or kind of in HR at a business, we're going to be hosting an event, our first event specifically tailored towards businesses. It'll be at the Voodoo's production facility. We'll have tables set up with resources that you can provide your employees, anything that you may think your business needs. Then we're also coordinating a community event at Active Aging. The date is not set for that yet, but all the events will be on here. We'll create another tab somewhere at the header for events, and people can register. Most of them will be free, and anybody can show up, but we'll post all those to the website. All right.
My name is Tracy, and I have the pleasure of being the director of the Community Care Network at Meure Medical Center. And what we are is the care coordination department for the hospital. So we're kind of the catch-all department for, if you're not sure how to access a resource, or if you feel that there's a gap or there's something missing, you come to us and we help you either find it, or if it doesn't exist in our community, we work with our other hospital partners and community partners to develop that resource. So that's how the Recovery Service Navigator position came to fall within care coordination, because it's saying, okay, within our hospital confines, yes, we have a lot of services, we have a lot of resources, Crawford County Drug and Alcohol, but a lot of times, like I said on the commercial, folks don't know how to access it until it's probably 10 minutes too late. When they're a friend or a loved one that's concerned about somebody, they may not be willing to call the actual drug and alcohol center to say, hey, what help is out there? But if they know there's a friendly voice on the other end of a phone that's called a Recovery Service Navigator. Recovery, that's such a different connotation that they may be more willing to reach out and say, hey, what's out there for me? What's out there for my loved one? In talking about the Let's Talk campaign, my favorite part is raising the awareness. So finding out within our community, touching base with all the agencies and entities that are working on fighting this, but finding out what are those gaps, what's missing. Let's talk about the stigma. Let's erase that perception that somebody that's fighting with addiction is somehow not worthy of recovery. In talking with folks that have struggled myself, that's been one of my initial parts of being the director for this position, is to say, okay, what was missing for you? So people that I work with that have struggled with recovery, some have won the battle, some are still struggling, is to say, what was that piece? What would have maybe made a difference for you sooner or earlier? That'll help us identify who are some of the people that we need to contact. What are some of the educational pieces that we need to work with our partners to put together? So as far as the recovery service navigator position, we're looking for somebody with a strong social service type background. We're still hosting applications, so if somebody's interested in applying, I'd love to hear from you. I want to find just the right fit, somebody that has that personality they can touch out and be empathetic, but also connect with the other services and resources. They have to be really efficient and be really driven, because this is one of the most important positions that I've had the opportunity to get to work with. So I'm really proud that the foundation is working with us to allow us to house this position, and excited to see what this person can do. So again, for folks at home, anybody here, if there's something that you're thinking of where you're saying, you know what, I have an idea of a missing piece, please let us know so that we can start working on that education, so that we can start working on that background. So within Crawford County right now, there's a group called Peace for Crawford that's really working on trauma-informed care. And I think it's really timely that this movement is kind of moving in time with the Crawford County Overdose Prevention Coalition and some of the other things that are going on, because it's giving us an opportunity for the first time in this community to take a step back and stop saying what's wrong with you and start saying what happened to you. Because if we can identify that trigger point for some of these folks, that's how we can start setting them on the road to recovery. What is it that they need? What is that missing piece? How can we identify it? So if we can get them into the proper counseling services, if we can identify, okay, what started you down this path to begin with, that gives us a much better chance at starting to identify the solutions. So again, you know, facing some of those things that may have happened to us as we were growing up that led us to some of our choices later on is really the key here. So do you guys have any questions about any of that? Or is actually, how many people have heard of trauma-informed care and Peace for Crawford? So yeah, just one. So if you haven't heard of that before, look it up. Trauma-informed care is a really important thing. It focuses on adverse childhood experiences and things that have happened to us in our past that we don't realize are impacting us into the future. So again, that's one of the big reasons that folks make some of the decisions that they do that lead them to their addictions. Not One More is doing a fabulous job out in the community, making sure people are understanding what's going on. There's a lot of other agencies and entities that are working really in tandem. This is not like one more thing to add a layer. This is the first time I've really seen in this community one project that has brought so many different people together. You have agencies that would typically be, you know, navigating for patients that are saying, okay, let's put all this down, let's work together, and whatever's best for this person, that's where we're going to put them. So aside from that, do you guys have any questions for me about the navigator position, or you know what the individual is going to be doing? Or if you have any ideas on directions that we should go, something you think they should do, let me know. I'm happy to hear that.
Tracy, is there like some other town, Meadville size, someplace that's also doing this, that's come up with the magic bullet that really worked, or you know, there's some mystical cure out there?
If you know, please call me. I'd love to find out and chat with them. I mean, I haven't found a place that quite has it nailed. There's a lot of different communities that are doing bits and pieces. I really think that with our trauma focus here in Crawford County, we are actually a step ahead of a lot of the other, especially rural counties in the area, in Pennsylvania, if not nationally.
Any questions for Tracy? Thank you.
All right, thanks.
It's also important to note that we're pursuing in year 2, we are pursuing a grant that we may be able to do it sooner, an employee assistance program that would be for businesses. So hopefully we could create alternative opportunities for individuals who either failed a drug test or whatever it may be. We can get the resources in businesses at no cost to the business, so that all their employees are well informed of their options and where to go when they need help. The Navigator, as Tracy mentioned, this is going to be a free resource. Anybody can call if you yourself are fighting an addiction, or you know somebody who's fighting an addiction. You can ask questions like, what insurance does X take? Or what do you hear about this type of opportunity? Or how far out are they scheduling? Are they accepting people right now? Any question that you may have, you can call the Resource Navigator and they will have the answer for you, or they will get your information and absolutely follow up. Their goal is to facilitate connecting people with the services that they need, not just providing information. So that is really exciting for us. Any questions? Thank you all very much. We'll post updates to this website, so please continue to check it, and then follow us on Facebook, the Foundation on Facebook, and follow the Crawford County Overdose Prevention Coalition on Facebook as well. Not one more on Facebook as well? Yeah, not one more on Facebook also. I'll plug all 3. If I could think of more, I'd plug them too, but thanks.